So our next antibiotic is cephalosporins. These are a group of semi-synthetic antibiotics derived from cephalosporin C obtained from a fungus Cephalosporium. And this is the structure. Okay, so you can see it is chemically related to penicillin since it also contains the beta lactam nucleus which is fused to dihydrothiazine ring. Next, by the addition of different side chain at position 7 of the beta lactam ring and at the position number 3 of dihydrothiazine ring, a large number of semi-synthetic compounds have been produced. When you give any attachment at the 7th position of beta lactam ring, it mainly causes alteration of the spectrum of activity, whereas addition of any group at the 3rd position of dihydrothiazine ring, it mainly affects the pharmacokinetics. Next, we shall check out the classification of cephalosporins. See, these cephalosporins, they are mainly divided into 5 generations. They are the first generation, second generation, third generation, fourth generation, and fifth generation. And this classification of the generation, it is mainly based on their spectrum of activity. Now you can grossly remember as first generation cephalosporin, they are just like penicillin. Just like penicillin means they will be mainly effective against the gram positive bacteria. Now, as we move forward from first generation to second generation to third generation and to fourth generation, the activity against gram negative bacteria keep on increasing. That means the fourth generation cephalosporins, they are highly effective against the gram negative bacteria. Now you can see first generation are effective against first generation is mainly effective against gram positive bacteria, fourth generation is mainly effective against gram negative bacteria. Now regarding second and third generation cephalosporins, they are effective against both gram positive as well as gram negative bacteria. And amongst this, the third generation cephalosporin, they has the most widest spectrum. Next, special point about second generation is some of the second generation cephalosporins, they are also effective against the anaerobic bacteria. Now we are left with fifth generation. This fifth generation cephalosporin, the special point to remember about this is they are effective against MRSA. These are the only beta lactam antibiotics effective against the MRSA. So grossly, the spectrum you can remember is the first generation cephalosporins, they are effective against gram positive bacteria. Fourth generation are effective against gram negative bacteria. Third generation have got a widest spectrum. Second generation are also effective against some anaerobes, and fifth generation they are mainly effective against the MRSA bacteria, right? Next, we shall check out the examples of drugs which are coming under this generation. So for first generation, the examples are cefazolin, cefalexin, cefalothin, cephaloridine, and cefadroxine. Next, for second generation, the drugs are cefuroxime, cefoxitin, cefmetazole, cefomandol, and cefaclor. Next, for third generation, cefoperazone, ceftriaxone, cefotaxime, ceftriaxone, cefpodoxime, ceftazidime, moxalactam, and cefixime. Next, for fourth generation, cefepime and cefpirone. For fifth generation, the drugs are ceftibiprole and ceftaroline. Okay, so these all are the drugs, the classification of cephalosporin with their examples. Now the next important challenge is how to remember these drugs. See, all these drugs are very much confusing, right? Now check out the first generation drugs. First of all, you can see all the drugs starts with CEF, CEF, CEF. But if after CEF, if there is A, that means that that drug belongs to the first generation. Okay, after CEF, wherever you will say if A is there after CEF, that means that drugs belongs to the first generation. But this has got one exception. Check out the second generation. We have got cefaclor. Okay, here also after CEF, A is there, but this cefaclor, it does not belongs to first generation, it belongs to second generation. And as anywhere, if after CEF A is there, that means those drugs belongs to first generation. Next, if suppose PI is there, CEF is there, and after CEF, if PI is there, check out the fourth generation. If PI is there, that means that drug belongs to the fourth generation. Okay. Next, if suppose after CEF A is absent, PI is also absent, but if role ROL is there, check out the fifth generation. If after CEF A is not there, PI is not there, but role ROL is there, that means that drug belongs to the fifth generation, right? Now next you check out the third generation. If after CEF A is absent, if PI is absent, ROL is also absent, but if the drug is ending with me, or if it is ending with one, that means that cephalosporin belongs to the third generation. But you can see moxalactam, it is something different which you can remember. Okay, if the drug is ending with me or one, that means that drug belongs to the third generation. But this has got one more exception. Check out the second generation. You can see cefuroxime, it is ending with me, but it does not belongs to third generation, it belongs to second generation. Okay, so you can see if any drug is of first generation, means after CEF A should be there, but one exception is cefaclor of second generation. Next, if PI is there, that means the drug belongs to fourth generation. If role is there, the drug belongs to fifth generation. Next, if a drug ends with me or one, that means the drug belongs to third generation. Now all the remaining drugs where there is no A after CEF, if there is no PI, no role, no me, no one, that means the drug belongs to the second generation cephalosporin. So this is one of the way by which you can remember the examples of drugs of cephalosporin belonging to their different generation. Next, we shall check out some of the important points regarding cephalosporin. The first point is almost all the cephalosporins are eliminated out by renal route except cefoperazone and ceftriaxone, because these two drugs, they are eliminated via the bile, they are secreted in bile. Okay, now what is the importance, why we want to know whether these drugs are eliminated by bile or not? Like, the thing is, almost all the beta lactam antibiotics, they are mainly excreted by the kidney, by the renal route. So if there is any kind of renal failure, they will get accumulated and they will lead to toxicity, right? But on the other hand, if a drug is secreted by the bile, then what happens? If the drug is secreted by the bile, means via the biliary secretion, they will enter into your GIT tract and it gets eliminated out via the fecal matter. Okay, so that means if we have an extra pathway through which the drug can go out of the body, so even if a person is having renal failure, this means that the drug is safer. Okay, so that these two drugs, cefoperazone and ceftriaxone, these two drugs does not require any kind of dose adjustment in case of renal failure, because they are eliminated by the biliary secretion. Next important point is which cephalosporin are effective against pseudomonas. Okay, see, many drugs are there which are effective against pseudomonas. Now among cephalosporin, we have got 4 cephalosporins that are effective against pseudomonas. They are cefepime, cefpirone, cefoperazone and ceftazidime. Okay, so you can see the first two drugs belongs to fourth generation since it contains pi, and the another two drugs they belongs to third generation since they end with 1 and me. Okay, so these are the four drugs which are mainly effective against pseudomonas, and among these ceftazidime they are most effective against pseudomonas. Next thing is disulfiram like reactions. There are some drugs when they are given with alcohol, they causes a reaction which is called as disulfiram like reaction. So some cephalosporins can interact with alcohol. So they should be avoided in alcoholic patients, and whenever they are given to a person, the person is instructed that not to consume alcohol. And these cephalosporins include cefoperazone, moxilagdam, cefotetan, and cefomendol. Okay, so these four drugs have got disulfiram like reaction, so they should be contraindicated along with alcohol. Next special point about these four drugs are these four drugs can also cause a problem known as hypoprothrombinemia, means they can decrease the prothrombin level, which will predispose a person to bleeding. Therefore they should be avoided in a person with bleeding tendency, like patients with hemophilia. We should not give these cephalosporins. Okay, so this was all regarding cephalosporin. Next we shall start our discussion regarding the carbapenems.